Hi, this is Colonel Pradeep Pindiala, Professor of Anesthesiology at Asram Medical College, Aiduru city of Andhra Pradesh, India. Friends, today I'm going to talk about communication skills. I assure you, you would love this talk and you would be definitely benefited. I'll be talking about communication skills to avoid conflict at your workplace, how to avoid violence against doctors and the hospitals by your communication skill, and how to be successful in your society as well as in your specialty by improving your communication skill. So let's start it. Please be attentive. That's my sincere request. That's all. Okay. Developing strong communication skills is integral to becoming effective healthcare provider. No doubts about it. In recent years, good doctor-patient communication has been linked to improved patient satisfaction, better patient care, and decrease in malpractice lawsuits. Patients won't take you to courts if you have good communication skills with the patients and their relatives and next of kin. It helps to diagnose and treat the disease correctly, to establish and maintain a therapeutic relationship with your better communication skill, and it would offer information as well as education. There's no second thoughts about it. Key features of good communicator. What are they? They are usually very interactive, dynamic, without about it, responsive, and good communication skill reduces the uncertainty. It's a planned thing and a purposeful thing. It welcomes practice as well as feedback. When you're communicating with the people, make sure you welcome feedback. Okay? Verbal communication skills would be providing structure, building good relationship, initiating the session. You should be master in that, how to start the session. Gathering information and physical examination. Once you are a good communicator, you get good, better history from this patient. And you would come to a correct diagnosis and go for the correct treatment. Explanation and planning. Explain the patient what you are planning, what you are doing, what is his disease all about, and closing the session. Non-verbal communication. Body language is a great communicator. By the way, when you're talking, eye gaze is very important. Never lose your eye contact, head movement. Make sure you understand the head movements of the patient as well as your own head movements. Facial gestures, very important. Patient is observing you as well as you are observing the patient. Postural orientation, body posture, postural chain, interaction space, gesture, hand, affirmative. Self-explanatory. An acronym is CLASS. C stands for context, the physical setup of the area, to interview the patient. Where you interview the patient, listening skill, L, to be an effective listener. The best part of communication is to be very sincere, genuine listener. Spend some time, genuine time, quality time, in listening to the patient or their relatives. That really pays. Acknowledge. Whenever you're speaking to the person or anything, you validate, acknowledge them, address emotion, their concern, their concern. Pay attention to that. Acknowledge their concern. Don't neglect that. Strategy to provide a management plan that patient can respond. Summary. Whenever you talk something, summarize it. Make sure the person has understood what you have conveyed. Has he registered or not? Has he understood in his own language or not? Have you spoken to him in the language he understood or not? Come down to his frequency, not at highest frequency of your intellectual level. Come down to his level and make him understand. Choose a physical area to have a private conversation. Whenever you're doing a conversation, privacy is paramount. There's no second thoughts about it. At the same time, patient should be seated closest to the physician. Very close to him, as close as possible. Eyes should be at the same level of the patient. Neither it should be higher nor lower. Present a relaxed demeanor. If you are relaxed, Obviously, your patients also will be relaxed. Maintain eye contact. Nothing like maintaining eye contact. I did mention earlier also. Only touch a non-threatening area. Hand or phone. None. You must touch the patient, but be careful about the cultural issues also. If you are in Afghanistan, don't start touching hand or phone. Saying that it is non-threatening area. It could have serious consequences. Be aware of the cultural issues with your patients. Listening skills, that's an art. Medicine is an art. Communication skill is an art. Listening is an art. Allow the patient to speak without interrupting them. Let them speak their mind. Nod to let the patient know that you are understanding and following them. Nod your head a bit. Show a gesture that yes, you are listening actively, not passively. There are time constraints. Let the patient know ahead of time. Don't suddenly disappear. Tell them that there is a paucity of time. Because of that, you're leaving the session of discussion. That's proper way of dealing with patients. Be empathetic. Sympathy, nobody likes sympathy. Pitying someone, ayo papo, are bichara, kya ho gaya? No, they don't like that. Empathy. Empathy means putting yourself into their shoe. Feel as if you're the concerned person. You yourself are lying on the operation table next to be operated upon. Think how you must be feeling, the same feeling the patient is having. Not that you become anxious like the patient, but you should know what the feelings are going on in his mind. That's important. Empathetic response. Identify the emotion, identify the cause of the emotion. Respond by showing you have made the connection between the emotion and the cause. Don't have to have the same feeling as the patient. As I just mentioned, the patient is anxious. Don't become anxious yourself to become empathetic. Strategy, the plan, appraise or clarify the patient, their expectations of treatment and outcome. Tell them what is the likely mode of action, what you are going to do, and what is the ultimate result, what is likely to happen. Decide what is best medical plan along with the patient and their relatives. If the patient has a wife, discuss that with his wife and children would be for the patient. Recommend a strategy on how to proceed. Evaluate the patient's response. See how he is responding. Collaborate and agree on the plan. It's very essential. Summary. Summarize the discussion. When we talk something for 5 minutes, 10 minutes, 15 minutes, summarize it. Make it clear and concise and make sure that, yes, the patient has registered what you're conveying. Check the patient's understanding. I just mentioned that. Check whether he has understood or not your discussion and telling him about his treatment and the diagnosis part of his problem. Ask if the patient has any other question. Ask him, does he have any other question? Make a clear contract for a follow-up visit. Don't disappear after that. Allow him to have a follow-up visit. Encourage follow-up visit. That's the real true doctor. Emotional conversation. Everything is emotional. You have to have emotional conversation. Be prepared. Expect emotion. Patient has come for his surgery or being admitted in the ICU for his medical problem or some other problem or gynecological or obstetric problem. Expect their emotions. Have a plan. Monitor what you think and feel. Practice self-regulation. Aim to turn the confrontation into conversation. Somebody is having confrontation with you. Turn with your magic of conversation skills and communication skill into conversation. Know when not to have conversation. At the same time, you should know when you should be quiet, not to speak. That's very essential. At the same time, have your eyes and ears open all the time. Listening, and listening. Not necessarily keep on talking. You can stop, you can shut up when it is necessary. Use non-judgment listening. Don't be prejudiced or biased. Non-judgment listening and understanding of the situation is very, very important. Remember, it's about the patient or their attendant. Maintain eye contact. Listen without interrupting only making clarifying statements and paraphrasing. Avoid trying to make situation better than it is going. If it is a high-risk patient, don't tell that nothing is going to happen. Tomorrow, if anything happens, he will lynch you. Bound to happen. Somebody has lost his father, mother, daughter, son. And when you say nothing will happen, and very next day someone toward thing happens. They are bound to react. They are human beings. They're not God, superhuman or something. They're human beings. Human beings have emotions and responses and reactions. You just can't say that you should not be violent or anything. You have to explain, you have to control the situation, create a situation where there is no violence. I'll tell you how to avoid violence at the workplace. If in anger, patient or the family responds, wait at least few seconds before and calm down yourself before you respond. The patient is very aggressive or insulted you or abused you. Don't react immediately. Have some time. Pass some time calmly. After that, you respond to this. Whatever he has said. Avoid being defensive. The moment you are defensive, the patient will feel that, yes, you have done something wrong. Don't be defensive. At the same time, don't be offensive. And don't play the blaming game. Blaming game, you have done the mistake. Don't say that. He has lost somebody at that time. Don't say that you have done it. You are part of it. Acknowledge emotions by empathizing. I already mentioned. Empathizing is very, very important. Putting yourself into their shoe. When emotional behavior escalate, you feel threatened, unsafe, stop the further interaction. Leave that place. Better be safe. Doctor-patient relationship. Patient do not fail treatment. Treatment fail to benefit patient. Let me repeat it. Patients do not fail treatment. Treatments fail to benefit patient. Most patients are anxious and fearful. Obviously, physicians should instill confidence and offer reassurance, but must never come across as arrogant or patronizing. Patronizing, you are the boss. There's no doubt. Don't show it out that you are the boss. Be part of the family. Be part of the system of treating. Be part with him and his concern. The doctor-patient relationship is in itself therapeutic. Half the problem treatment is already done if you have good communication skills with the patient. A successful consultation with a trusted doctor will have beneficial effects, no doubt, irrespective of any other therapy given. Types of doctor-patient relationship. This may be a confusing slide, but I will make you understand every word of it. Patient control, low, high, doctor control, default, low, consumeristic, doctor control, high, paternalistic, and mutuality. I'll make it understand. Paternalistic relationship. You are a father or mother to the patient. Patient surprisingly loves that. How? A paternalistic or guidance cooperation relationship involving high physician control and low patient control. Here, doctor is dominant and acts as a parent figure who decides what he or she believes should be in the patient's best interest. Surprisingly, at the same stage of illness, patients derive considerable comfort for being able to rely on the doctor in this way and being relieved of the burden of himself worrying about his problem and decision making. He loves having a paternalistic relationship. What is this mutuality relationship? A relationship mutuality is characterized by the active involvement of the patients as more equal partners in the consultation. They're equally involved. Here, both parties participate as a joint venture and engage in the exchange of ideas and sharing of belief system. The doctor brings his or her clinical skills and knowledge, and patients bring their own expertise in terms of their experiences and explanations of their illness. It's wonderful. Consumeristic relationship. Don't encourage that. Here, the patient thinks he's the boss. Why? He's paying you. He's a consumer. He thinks that I'm paying you. I should decide whatever is going to be done. No, don't encourage that. Consumeristic relationship describes the situation. This power relationship are reversed. Here, the patient takes the active role and the doctor adopting a fairly passive role. Please don't encourage that. Doctor accepts the patient's request. A second opinion, हमें second opinion चाहिए. Refer me to a better hospital. write something, a note, and so on. Don't encourage that situation. Default relationship. How? A relationship default can occur if patients continue to adopt passive role, even when the doctor reduces some of his or her control. What happens? This can arise if patients are not aware of alternatives, different types of relationship, particularly those characterized by paternalism and mutuality can be viewed as appropriate to different conditions, stages of illness. For example, in emergency situations, it is generally necessary for the doctors to be dominant. In an emergency, don't ask his opinion. Take your decision. You're dominant. You should be dominant. You should dictate terms. However, that's an emergency situation. By default, you're the boss that time or decision maker. However, in other situations, patients can be more actively involved in treatment choices. Duties of good doctor. Who is bad doctor? I don't know. Everybody, all doctors are good. They should have plenty of knowledge, latest skills, upgrading their skills and knowledge like CMA you are attending. ISACON 2021 at Ahmedabad. Hybrid, both on the ground as well as online. This is it. You're improving your knowledge, skills, and performance by attending CMA. Make the care of your patient the first concern because you're concerned with your patient's care. That's why you're improving your skills and knowledge, upgrading your knowledge in anesthesiology and critical care management and other things. Provide a good standard of practice and care. Good. Once you're good in skills and knowledge, obviously your practice skills will be better and care and outcome will be better. Safety and quality is paramount. Protect and promote the health of the patient. Take prompt action for patient safety and dignity. That's very important. Communication, better partnership and teamwork. Treat patients as individuals and respect their dignity. Don't treat as hemorrhoid patient, this thing, hernia patient or appendicitis patient. Please name, if you know the name, tell them that particular patient. They are individuals and respect their dignity as well as privacy. Respect patients' right to confidentiality. Don't start discussing patients' matter along with your friends and his others and openly putting it in the social network or something without his permission. It's very bad. It hurts mutual trust between doctor and a patient. Confidentiality is paramount. Work in partnership with patient. Work with colleagues in the ways that best serve patients. Your colleagues also should be involved in the treatment of your patient. That brings better. Maintaining trust, be honest and open and act with integrity. Never discriminate unfairly against patients or colleagues. Never abuse your patient's trust. It's very, very important. Barriers to good communication. What are the barriers for being a good communicator? If you're authoritarian or dismissive attitude, if you have that kind of bossy attitude, you can never be a good communicator. Hurried approach. If you never have enough time for patient listening, you can never be a good communicator. Use jargon. You start telling in medical jargon and high sounding diagnosis and syndromes to patients. He won't understand, poor guy. Make him understand the language he understands, come down to his level, his frequency. Inability to speak first language of the patient. That surely is a bad situation when you can't speak his language. Preferably talk in Hindi or English. In his simple words, not high British accent and American accent English. No experience of patient's cultural background. You should have a little bit of cultural background experience of the patient that brings her better result. Patients, what is the problem with him? His communication. If he is anxious, he can't communicate. Reluctance to discuss sensitive and trivial issues. He thinks in the patient history taking that is very sensitive or trivial issue. He doesn't reveal it. His diagnosis goes wrong. Treatment goes wrong. Communication is good. He will tell you all the sensitive and trivial issues, and that helps him. Better diagnosis and better treatment with your communication skills. Misconception. They may have misconception. Conducting sources of infection, information, cognitive impairment. They may not be intellectuals like you. Hearing, speech, visual impairment. Or many times they have hearing, speech, visual impairment. You must understand that. Consent. Section 13 of Indian Contract Act, 1872, where two or more persons agree upon the same thing in the sense they are said to have consented. Consent can be given by any person who is conscious, mentally sound, and about 12 years of age. When a consent is not valid under fear, fraud, misrepresentation of facts, or by a person who is ignorant of the implications of the consent, who is under 12 years of age, consent is invalid. Depending upon the circumstances, in each case, consent may be implied, expressed, verbal or written, or informed. You know it better, you do it every day. Conflict in workplace, that's very important situation. Managing conflict in the workplace is very important. The workplace is a time-consuming but necessary task for the physician leader. Conflict may exist between physicians and staff, and between the staff or the patient or patient's family. Convert conflict into conversation. Conflicts have an adverse effect on the productivity, morale, and patient care. They may result in high employee turnover. Employee turnover means they leave the job. The people who are working leave the job, and the new people come. That is disastrous. And certainly limit staff contributions and impede efficiency. Disruptive physicians don't allow them to flourish. The dysfunctional physician presents an insidious cost and practice or healthcare organization. This increases the stress in the work environment. Once the dysfunctional behavior pattern is recognized, an intervention should be made. When a confrontation is necessary, a team approach should be used. Empathy should be expressed, but change must be demanded of such person. The communication should be direct, clear, with the subject not given an opportunity to respond until the end of the dissertation. Finish that issue with such people, wrong people. Don't encourage them. However, individuals who have a destructive effect, negative attitude and negative speaking and attitude and work thinking on the workforce should be asked to leave before they cause harm to you and to your patient and to your reputation. Prevention of conflict. To prevent conflict, the professional code of conduct should be established, not only in the hospital, but also as part of the group policies and medical staff bylaws. Ground rules make it easier to discipline. Everyone needs to understand that there are firm limits of inappropriate behavior beyond which we cannot tolerate it. Understanding how conflict arises is important for its prevention. Emotional intelligence, very important. Emotional quotient also, they say. Emotional intelligence has been recognized as necessary, not only to be a successful leader, but also to be successful in your life. Successful in your own life, not only in anesthesiology or anything, or in your medical practice. Everywhere. Emotional intelligence involves self-awareness, management of emotions, empathy, people skill, and motivation. The development of interpersonal intelligence allows understanding of other person. It helps understand and recognize their own emotions. You should know yourself first. You should know your own emotions before understanding others, making control of those emotions easier. Interpersonal communication. Communication in the medical act is an active process. Perception of information, active listening skill. In the medical domain, communication represents a fundamental clinical skill. The quality of information obtained with the doctor during consultation closely linked to his communication skill. In the communication with the patient, listening and time availability are the best. First, the listening must be active. Particularly, attention must be given to non-verbal component. Adopt an open, patient, and calm attitude. Eye contact with the mouth, facial expression, very important. Listener must be empathic. Violence against doctors. No physician, however conscientious or careful, can tell what and which are. He may not be object of some undeserved attack, malicious accusation, blackmail, or suit for damages. Doctors are the ones highly revered and respected by patients. However, this has become extremely rare now. They are increasingly being subjected to verbal and physical abuse. You are seeing it all over the world. Moreover, the situation in India is the worst in the world. 8 to 38% of health workers suffer physical violence. 1.6 million people die due to poor quality of healthcare. Highest rates of violence occur in obstetrics, gynecology, next medicine, next surgery. 75% of doctors face assault at the workplace. 70% of doctors feel unsafe while treating the patient. Very unfortunate, but it's true. Violence against doctors is not just confined to India, but it's a worldwide phenomenon. Acts of violence are mainly verbal and physical, and occur both in hospitals and private clinics. Western countries, major violence makers are patients or their close relative. So, in India. What are the physical violence, mob lynching, blackmailing, harassment by police and politicians, cyberbullying, abusing, verbal intimidation, just so. Poor quality of healthcare in the majority of government sectors. The negative image of the doctors and the role played by media is harmful. Poor socioeconomic situation of the patient. They can't afford the treatment. Poor communication, vulnerability, low awareness and knowledge about the health literacy, lack security, inadequate security arrangements is very hazardous. Mob mentality, instant justice of the people, patients is dangerous. Violence against doctors, attack the patient relative. You have studied 10 to 15 years this, and this is the end of it. No personal family life. You don't have any such life. Harassment by police, politician, poor infrastructure, most government services, draconian laws against doctors. Very unfortunate. Violence against doctors can lead to development of psychological, psychiatric problems in doctors, depression, insomnia, post-traumatic stress disorder. Agoraphobia means fear of the crowd, fear and anxiety, often leading to absenteeism, loss of productivity in the long term. Warning signs of violence. Stamp is staring, tone, anxiety, mumbling, pacing. Staring is a prospective sign of violence. The tone and volume of the voice are connected with violent episode. Anxiety is coming to the emergency department, makes patients stressed out. Mumbling is an indication of violence. Pacing by relatives is seen as a symbol of agitation. Prevention of violence. With the rise in mob violence incidents, doctors are becoming cautious and reluctant to take up serious and grave cases. Very unfortunate. This in turn compromises healthcare, which defeats the purpose of the healthcare delivery system. Knowledge dissipation. The general public should be educated. This will generate health awareness. Media should play a role. Strengthening primary health care, strengthening of infrastructure at PFCF, sub-healthcare centers are important. Communication and empathy, I have already told about it. Workplace safety, safe work environment, and congenial atmosphere is very important. Proactive media. Media should help us. They should play not a villainous role, but proactive, positive role. Security and monitoring. Security in government hospital is grossly inadequate. Political interference is really bad. That VIP culture of politicians should not be tolerated. Strict punishment. There should be strict punishment and conviction for people who are violent against doctors. Medical Protection Act has currently been implemented in about 23 states. Andhra Pradesh state, where I'm working right now at Asram Medical College, is the first state to implement MPA in 2007. Doctors' attitude. There is a need for a change in the attitude of doctors towards the patient. Role of medical schools. Medical schools should teach communication skills more. Role of hospital, improvement of services, employment, improvement of infrastructure is very important. In brief, in summary, the primary objective of the doctor is to listen to the patient. Shared decision-making between doctor and the patient will determine the most appropriate and best course of action. Communication becomes increasingly more a therapeutic technique. The medical curriculum should include soft skills like communication skills. Both doctor and patient have a role to play in avoiding unnecessary violence. Thank you for patiently listening. I am stopping the video. I'm most welcome. I'm welcome to all your questions.